The only way to get here is by air or ship. Dr. Camilo Prieto has organized an airlift to bring much-needed help during the COVID pandemic. Today they're off to Timbiquí, near Colombia's Pacific coast. This dangerous area is teeming with armed groups. Since the beginning of the pandemic, the need has become even greater.
Needle holders? None. Scalpel handles? None. Sterile compressors? They say, doctor, the compressors aren't sterile. So much is lacking.
Dr. Camilo Prieto works as a plastic surgeon in Bogotá, where he performs cosmetic surgery, but also helps disfigured accident victims. He lives with his wife in one of the better neighborhoods of the city. His housekeeper comes to clean regularly. The doctor says goodbye to her and leaves for the day.
Cuídate mucho. Chao. Todos los días percibo contrastes.
Every day I see this contrast between my own life and what's going on out there in my country. I think the opportunities life has granted me come with a responsibility.
When the pandemic began, Dr. Prieto started collecting donations, such as masks, medicines, and disinfectants, mostly from big companies and private donors. Volunteer pilots at the Pacific Civil Air Patrol, for example, are also happy to support Dr. Prieto in his efforts. Occasionally, there are complications to deal with. Pilot Jose Luis Oliveros talks about a recent mishap while attempting to land. After being warned of cows on the runway, he was forced to fly over and restart his landing maneuver. During trips to remote areas, such experiences are commonplace, with no fences around the landing strip, no tower, and no air traffic controllers. Fortunately, upon arriving at Timbiquí, he finds the runway empty. At the beginning of the pandemic, the community was virtually cut off. There is no road leading here. And since last March, air traffic has been irregular. This presents a problem for the inhabitants, who receive food and clothing by air and ship, and hospital supplies are particularly vital. The hospital is responsible for around 20,000 residents in the surrounding area, and it lacks even the most basic facilities. No blood reserves, COVID tests, or oxygen tanks. Regional health official Carmen Yasmin Hernandez is exasperated.
We have many remote areas, and it can take people 7 or 8 hours to get here. And when they do, they often can't be treated. Then they're referred to larger hospitals, but that costs time and money and can prove fatal for the patient. This hospital is a lifeline for all of Timbiquí.
This woman needs help for her daughter. She's been suffering from severe diarrhea for days. They even took a boat to reach the hospital. But to her dismay, the doctors can't help.
I've been here for 3 days with my daughter. They did examine her, but couldn't give her the treatment she needed. But the diarrhea went away on its own.
Even though the hospital has the best equipment in the area, At the moment, there's no running water. Time and again, the power goes out. Protective clothing is also scarce. So Dr. Edgar Ibanez is delighted to receive Dr. Prieto's protective masks.
They're very important, as it's the only way for us to fight the pandemic. But it's even more important to talk to the people and build awareness. They party here at night with almost no one wearing masks. You only really see masks in the hospital.
Dr. Prieto does what he can. Several people from the area have gathered in the waiting room, where he is answering questions about COVID.
On television, when they talk about the coronavirus, sometimes they talk about the effectiveness of the vaccination, but over a longer period of time. So, if I were to get vaccinated today, how long would I be immune? And does it make a difference if I've had the first or second jab? I can only tell you what we know so far, since the vaccine is quite new. We're still learning a lot. But some studies have shown the vaccine provides 8 months of immunity. It might be a bit more, but we're not sure. And we have to wait and see.
Dr. Prieto treats a boy with a severely infected hand, having to make do with few supplies in an attempt to avoid having to amputate the child's finger. Instead of putting the boy under, he uses a local anesthetic with no sterile gloves or compresses.
Defining inequality is hard, but when you're in a hospital like this, you really understand what the word means. What it means to not have access to healthcare. What it means when doctors want to help their fellow human beings but can't. Because they don't have the resources, and they don't have the connections to the state government.
For the people here, there are bigger concerns than the virus. Masks play hardly any role in their everyday lives. There's not much work in the region, and people are afraid of criminal gangs, since the area is a corridor for drug trafficking. Dr. Prieto feels it's all the more important to win over people's trust. That's why he makes house calls. Today he's brought masks and explains how to use them to protect against the virus.
¿Cómo estás? ¿Cómo es tu nombre, perdón?
He explains to this woman how to use a mask correctly. He offers her several of them, but asks her to dispose of them properly. He shows her that she should wear them with the blue side facing out. It's important to his donors that he documents his work, since donations often don't reach their proper destination. Dr. Prieto tells the boat driver he's ready to set off again. After delivering the masks, he heads back.
I think at first they were a bit skeptical and dismissive of the masks. But then they were really thankful. I hope they'll use them whenever possible.
Back in Timbiquí, there's good news. A military helicopter is arriving with the first vaccines, with 400 doses for healthcare workers and people over 80. The town has been waiting a long time for this. Colombia's vaccination program got off to a slow start, but with vaccines now reaching even remote areas, there is now at least hope. Just one little jab, and the first doctor in Timbiquí is vaccinated. Dr. Prieto hopes the vaccinations will change the public mood, making people less skeptical of the health measures. On his way back to the airstrip, he stops one last time and spontaneously hands out a few more masks.
I feel like we haven't done much and a lot is still lacking. The pandemic has left behind deep wounds. Inequality and injustice persist. But still, our actions aren't in vain. Each day we are creating hope, and that can really affect change. And hopefully it will help us live in a better country one day.
Dr. Camilo Prieto started his airlift in the pandemic, but he wants to continue it, even if everyone is vaccinated and the virus is finally brought under control.